while giving enteral nutrition, we should always you should always understand that only when the patient is hemodynamically stable, we should start enteral feeding. That's the first thing which we should take into the thing. And once the patient is hemodynamically stable, we should immediately start enteral feeding, or you should feed the patient. So it can be oral or it can be enteral, but if the patient is not able to take oral, enteral has to be done. And early enteral nutrition is definitely very important in providing a proper nutrition support for patients in the hospital.
Yeah, this is something, which we work together, for so many years in at SMF. So
Yeah.
whenever, there is, as he said, when there is hemodynamic instability, then nutrition is not a priority. Correct, Bamini? Uh, so that
Correct, sir.
it's more like,
Yes, sir. Very correct, sir. Yeah.
giving IV fluids, getting their BP and pulse rate and all that back to normal. So the nutritionist will take a back seat during that time. Once the patient is hemodynamically stable, then nutrition comes. And we worked with so many patients, and Bamni and her team have worked wonders. And she's very, very particular that she will not start TPN unless she's exhausted all efforts to start enteral feeding. So now we will get into that also a bit later. So the next question I wanted to ask you is, are there guidelines for tube feeding, and can you just explain about that?
Yeah, there is actually many guidelines, but for nursing, I will tell you there are 6 guidelines actually what you have to do for best practice. Appropriate, the selection of appropriate administration of tube feeding is very, very important. So the nurses are the first person to see the patient, and if you feel that the patient is not taking orally, you have to immediately inform the doctor or the nutritionist to say that the patient intake is not enough, so that the you can select and administer the tube feeding. So this is very important. So nurses play a very important role at this point of time to capture the patients who are actually wanting for enteral nutrition. At the same time, when the patient's on enteral nutrition and you find that the patient is also taking orally enough, then you can also report to the doctor saying that enteral feeding, the orally the patient is able to tolerate. So why don't we change to oral feeding and taper the enteral feeding? Even here, the nurses play a very important role in getting that done. So selection and administrative of tube feeding is the first guidelines which I could tell you. And second one is tube feeding formula. So you must understand that what type of formulas are available, how much it has to be given. See, all this will be planned by the dietitian. Since then also, you are at the bedside to see that it is properly done. Okay. So I think the network is issues there. So should I go by my mobile?
No, no, we can hear you properly. Now you're okay.
But I could get some chats. Okay.
No, no, that was
So
before.
feeding
That was before.
formula
So
is
no,
very
yeah.
okay. Yeah, feeding formula is very, very important. So you have to know what is the feeding formula you're giving to the patient, because even the dietitian will write in the report what formula, but that has to go correctly to the patient. Okay. So I will also show you that in a few of my slides. Yeah. Next slide. Next point. Appropriate route and the method of feeding delivery is very important. So what type of this also nurses play a very important role, because we should able to know this patient can tolerate feed by NG or post pyloric. Sometimes you can catch up faster and tell this patient will need post pyloric. So it is much easier for us to give the nutrition support and also give the delivery of the feeding delivery of the patient also will be very, very appropriate and as required and without much complications. So this is also important role for the nurses to know about it. Yeah. So the next one would be the what are the some monitoring to prevent problems. There are few complications or few problems which can be easily prevented and monitored, where the documentation of nurses are very important. So once that is being done, the next guideline, what is the different complications, you can see that next point. So you can see what are the potential problems which will be associated in feeding, that is metabolic, gastrointestinal, and mechanical. Most of the problems can be really made very minimal if there is a proper guideline followed. The proper mechanism if you follow, and if you report directly to the doctor or to the dietitian, these things can be really taken care. So the potential problem associated with all these three can be nil by nurses guidelines. So the last one would be the safety. Okay, what is the different principles of food safety which you have to see? Because in some of the hospitals the preparation is done by the nurses at the bedside of the patient. In some it is being done on the closed unit, like where in ICU sector the nurses prepare the enteral feeds. So you should know how to do it with the food's full safety precautions. And it has to be storage also you would be knowing, because in preparation you should be knowing about the osmolarity, because you should not be giving more osmolarity also. So that part of it I'll take when I'm talking about preparation. And storage, it is very important that the hanging time and how long it to be stored, feeding, these are very important. Even a small mistake where you do, or that also lead into gastrointestinal problems. So that is also a very important thing which you have to know. And also how to deliver and administer the feeds, because there are different type of administration, bolus, continuous, cyclic, there are many things, but you should know which is the best for that particular patient where you're going to provide nutrition support.
Thank you, Bonnie. That was quite exhaustive and you covered quite a lot over the guidelines. So let's get into the next topic of selection of tube feeding. How do you go about selecting the uh, what type of tube feeding needs to be done?
Yes. See, actually, we should know that for NG tube, you should know what are the fringes to be used. We should also know for, post pyloric, the smaller fringes, and you should be knowing what type of material, polyurethane is the best. So you have to know all those things which you should be knowing and which is best for the patient, because some patients are not affordable, and you think that they can go with 14 fringes, then you can go with those normal tube feeds or rails tube feeds. Okay, rails tube feeding tubes, you can go through that. And suppose if we find that these patients will not tolerate that, then we have to see the smaller bore tube feeds to be selected. So the selection of tube feeding is very very important while placing it. And also you should be assisting, or you should be documenting what actually the patient, what type of feeding the patient, what type of tube the patient will be requiring. Also, you can always assist and inform the doctor or the dietitian.
Right, thank you. So I think here there are some information.
Pictures, yeah. So incorporate the tube feeding in overall care. That is, whenever you're writing a care plan of tube feeding, you should first say what is the tube size which you've used, where it is being placed. All this has to be mentioned in your record, medical record, documentation of nursing on feeding. You have to write what enteral tube feeding you've been using, whether it's nasogastric or nasointestinal, or nasojejunal or duodenal. So you will be writing that, and you should always say it is whether it's gastrostomy or peg. All that information should go in your record. And second one is I told even the size of the tube will be very helpful. Suppose if the patient has got some erosions in the nose, I'll show you some pictures there. In that place we can go for a smaller one. So all that, if you record and document it's much easier for a best plan. So always, why I am putting this slide is the actually more than dietitians, nurses play a very important role in providing nutrition, because they should have the knowledge of nutrition. Only if they know nutrition plays such an important role, even a day delaying the nutrition support will deteriorate the patient's outcome. The outcome can come down even in one day if you delay. See, in ICU, if you don't provide one day a proper nutrition, you can see the weight, muscle loss. You can see the patient deteriorating, and also the length of hospital stay for the patient will prolong if you don't provide the proper nutrition support at the right time and appropriate time you have to give. And appropriate feeding also should be done, and there are so many things which you have to see. All this, if you have the knowledge, you will be the first person. See, in the night dietitian may not be there, but you will receive a patient where you need to start a feeding. So you should be knowing these knowledges, where immediately you can, you should, even if the doctor doesn't think about it, you should say, shall we start enteral feeding, sir? Because the patient is fine, we have to go. Even a delay in nutrition will be a negative outcome to the patient. So you should be knowing that much important, that any patient who is coming to hospital should maintain, okay, improve. Of course, in certain conditions we can do, at least maintain the nutrition status is what we should think. In our SMF, we did a study and we were able to maintain the nutrition over 82% of the patient and improve 3%. Deterioration was not much. So this is what the criteria should be there. And always understand that it reduces the length of stay nutrition provides. And also poor oral intake has to be immediately informed to the dietitian, because she may give you some ONS, that is oral nutrition support, she may try to give. Or she may even try to change the oral what the patient wants. Or she can even report to doctor saying that this is not enough, so we can go for enteral feeding. These discussions on support team can happen only with nurses report. So even if the patient, we want to discontinue, because we need not keep on giving tube feeding. Okay, if you find that the tube feeding patient is able to take orally 75%, then weaning of enteral feeding also plays an important role with the dietitian. I mean, sorry, for the with the nurses and dietitian in a team. So this is very important for nurses.
Yeah, that's great,
You
Bamini.
you must.
Sorry, go on, go on, go on.
So this is very important. You should be knowing about the nutrition importance, and it has to be started immediately whenever
I'm,
it is needed. Yeah.
yeah, I'm really glad you emphasized that, because I teach my postgraduate students, before you have your breakfast, you better make sure that your patients are fed, right? That's what, I will tell
That's
my
very so.
postgraduates, and I think it is very, important that you emphasize this, the importance of feeding in the overall management of the patients. So we'll move to the next question. How can we assess the patient's tolerance to tube feeding? How do we know, a patient is tolerant or not tolerant or intolerant to the tube feeding? After you initiated it, what are the ways in which you can find this out?
Yeah, you have to see whether the patient's GI residue. You have to see for the residual thing, how it is. Gastric residues has to be seen, and then you have to look for there is any loose stools or motions, and you have to see whether the patient's regurgitation is there. So there are so many things you will be looking at, and if you I will be explaining in one of the few slides which is coming back to you.
Okay, let's move on.
So actually this has to go in the beginning. Anyway, I'll just tell you, you must have at least a minimum knowledge. You need not know too many things, but at least you should have a minimum knowledge that we should be providing around 20 to 25 kilocalories per kg body weight of energy to the patients, and zero point 0.8 to 1.2 grams of protein per kg body weight per day. And very simple, 1 ml 1 kilocalorie per day. This is going or not, you can see. Okay, this is has to come in the before thing. I think the slides got.
Okay.
Next slide. And whenever there is a yeah, can you go to the before slide? I just wanted to say this very important: increase free water intake during the needs. Okay, you need not wait for instruction from the dietitian or doctor. Whenever you find that the patient needs a free water, you can definitely do it, and then also inform, because even a few hours or delay in providing free water also leads to dehydration. Okay.
So what do you mean by free water? I mean, when the patient is having enteral feed, so they can
You
actually
can
give
push somewhat. Yeah.
in the syringe, just push
You
extra water.
push, yeah, push 50 ml to 100 ml of water, free water, when you
Got it.
find that the patient is going for potential dehydration.
Okay, okay, that's great. Yeah. Okay, now we're answering, we're getting into the tolerance. Yeah.
Uh, so you have to know the amount and frequency of stool. That is very important. The documentation. Suppose if you go and say the patient is passing stools, one or two stools or three stools, this is what the doctor will take it, and for reducing the strength or stopping the fees, all this what you are giving the report is what the document, what you're saying is what is being taken. So whenever you're looking at frequency of stool, even there is a 4 5 stools, but the quantity amount is very small, that is not a diarrhea. Okay, so you must understand that more than 300 grams, if it is more than that and it is 2 3 bowls heavy, then only we can say it is diarrhea. So small, frequent, sometimes it can be a constipation leading to fluid coming out, that cannot be taken as consideration as a diarrhea. So you should understand that the what is that you will say when a patient is diarrhea. The definition of diarrhea should be known very nearly. And second is abdominal girth. Measure the abdominal girth every 6 hours and report whether if there is any distension, if there is where you can find that there is a patient is not able to tolerate, there you can find out. And we can also see in residual, I said no, gastric residual 4 to 6 hours. But the latest guideline says for generally a patient who is on a for for formula feeds, and we need not do gastric residual checking every 6 hours. Okay, that is what the ISPEN guideline says. But when you find a patient who is having a issue of then of GI issue, then you need to do this at least 4 to 6 hours to see whether the tolerance is there. And you also should account urine output. This is where you can assess the tolerance of tube feeding.
And the other is urine
Next slide.
output.
Urine output. Yes, urine output you have to measure, and always report when there is a lesser output, and where you should also report for positive, more than 1.5 to 2 liters, more than the intake also should be reported. So urine output is also one of the indicator for tolerance of tube feeding.
Okay, thank you so much for that.
Next slide.
Yeah. So,
And also do not check residuals with small bowel feeding tube. Okay, you should never do it. This is the that's why we put it in red. Please don't do it, because many of the nurses, without not knowing the thing, they start check the residuals with small bowel feeding tubes. It is no, a big no.
so why is it, it's not necessary? Can you explain that?
Syringe, it's better to do with syringe. Sometimes this small bowel feeding tube, if you start doing it, even the fluids which are always will give you a wrong information. So that is why you should not be doing with small bowel feeding tube.
So they will aspirate the intestinal fluid and think the residue is more. Is it?
Intestinal fluid, and they say it is a gastric fluid. Yes.
Can you say that again, Bamini? Your voice broke a bit. Can you say that again?
Yeah, see, actually, when sometimes you may go into wrong information of this intestinal fluid to gastric. aspirate. You may say, you may go into wrong, giving a wrong information to the doctors, because if you do by checking with small bowel feeding tube, it's better to do with your syringe.
Okay. Now, I think most important question. I think there are so many formulae available. Now it's very confusing. I think can you throw some light on how do you choose a tube feeding formula?
Yes, this basic knowledge, you should be knowing. You should know that there are different formulas for enteral feeding. There is a standard formula where it is like a polymeric formulas. What we say, it is normal. Carbohydrates, protein, fat, everything is being put in and most of the formulas are lactose free. So you should always be very strong to say, doctor, it is not because of the product, because most of the products are almost all the products, I could say 100% the products are lactose free. So it cannot be from the formula. You must always, whenever there is a loose stools or a patient, we should understand why it has happened. What is the reason? Maybe because of the antibiotics, or because of some of the prokinetic agents which are used. Sometimes these magnesiums which were used for some of the drug nutrient interaction can also be the reason. So standard formulas will have lactose free, so usually they don't cause diarrhea. Then you have specific formulas. For diabetes we have, for burns high protein, for cancer prosure, for a different metabolic states like COPD. Some patients with diabetes, we have a different product. So you must understand there are specific formulas available. And you also should also understand that the organ system dysfunction also we have. Renal products we have, liver products we have. So COPD also we have products. So you must understand that just saying ensure is not any one product. I'll just show you in the next slide. So there are at the behind there will be like low protein, high protein. So these are the things you should read and provide. Many of the times there are two times which we have put into the quality team also of providing the wrong formula feeds. See, you can we write in the dietitians write in the slip, but the formula has to be the tin has to be read by you and then only to be given. So you should know there whatever what product you're giving, you should be knowing, because we have so many different products for liver, renal, COPD. And for GI impairment we have semi elemental formula where it is been more digested form, okay, small peptides. And so these are used when the patient has intolerance of GI. Suppose the patient has got a lot of vomiting, and then if you some of the pancreatic patients where we use semi elemental formula. So you should also know that semi elemental formulas are also available in the system. Next slide.
Yeah.
So see, you can just see the resource is there and renal is there. One small letter. Suppose you just read the resource and alone feed the patient, and the patient is a nephro patient where you cannot give sodium high and potassium high. Whereas this product, that renal product, will have potassium and sodium low. And if you don't read it and then you just give something like that, a resource opti is there. So if you give for a renal patient, it is a problem, right? So electrolytes issues will be there. And the same way, when you're going to give a resource high protein for a patient who is a renal patient, even there you will get into problems, because we need not give that much of protein what is needed. These high proteins are given only for patients who are having burns, and sometimes when we want to give for some of the patients with cancer, we use that. Okay. So again, see, ensure means it's not simple ensure. There's ensure plus, ensure diabetic care, nephro, low protein, high protein. So there are so many variations. So the variations, you should read the prescription by the dietitian very nicely and only then provide. And sometimes what happens, the morning there will be one product, and the afternoon dietitian would have changed the product. Okay. So morning she would have given ensure, but then what happens when she goes around, she finds that the patient is intolerant, so she'll go for peptamen. Okay, that is a semi elemental formula, so she would have changed the formula. So every time when you feed, whenever you hang any feed, You must check formula every time. It is not that one formula will be there for 15 days till the patient is there. It may change. It may change according to the requirement. So always ensure that you read what is there in the prescription by the dietitian and then provide. So many times I would have changed the formula, but 2 days later I'll see the same ensure product will be in the patient bedside, but I would have changed it to peptamen, and still I have a problem. Why this problem? Then if you go through, then we found out that once like that also has happened. That's why this slide is specially put for you all to understand that you must read the read the product name, and then only provide to the patient. And every time when you mix, not that each day, each time when you mix and then only give.
Thank you so much. I think one disclaimer, both Bamini and me have no uh, association with any of these companies, nor do we have any financial implications out of this. This slide is purely to tell you that there's so many formulations and that you should make sure that you read them and then start the feeds. So let me just go to the next question. It's coming to the more practical aspects. How do you actually administer the tube feeding formula?
There are many systems, like you have a closed system, then you have an open system, and then in a closed system you have enteral feeding infusion pumps. Most of the hospitals are now having infusion pump, because what happens, some of the you can go to the previous slide please. So the infusion pump is very important. What happens is we will put for 4 hours. Suppose if you don't have a proper enteral feeding infusion pump, the feeding will not get completed. So it will get hanged. So what happens is the next feed will prepare and it will come, but the previous feed will be stopped there and it is not been fed. So what happens is the requirement what we planned will not be getting into the patient. So infusion pump will really help to see that it goes on time. Most of the hospitals have this. It's not it's a one time expense, but it is very useful. At the same time, feeding bags. Before we used to have some bottles and sterilizing and doing that, but now we have feeding bags. These bags can be reused for some time, though the company will say that you cannot use for many times, but we can definitely wash it properly, keep it very hygienically. We can repeat using it, because we are not in a place where we can throw off the feeding bag and use it. And we should always have you should always be having a measuring cup, water, syringe, strength whenever you're giving the feeds. Okay, all these in the tray, it all should be there when you're going to the patient for feeding. So I said, no, there are two different types of ways of giving the administering the enteral feeding. One is called as closed system, where the formula is actually pre-filled by the manufacturer into the feeding reservoir. It will come in a hanging bag only. Directly you have to hang it. Okay. So there are many available products in that. For ICU patients, very important, because no handling, just it is already been pre-packed. Only thing is you have to hang it and push it. That's it. So this is a very useful system to reduce the contamination. So, but it is very expensive. So many of the times we cannot be using this for all patients. Maybe for ICU, where you find that the reducing the infective rate, then you can use that. So another one is open system, where the formula is decentered into original containers, like this bag I was talking to in that you can add the you can take the measuring cup. How many cups is dietitian said 4 5 cups, 5 cups you should measuring cup, you should put the enough water, mix it, and then hang it. Okay, this is called as open system. And whenever you're doing this, the hang time is very important. Okay, when you do it in open system, the hang time is 4 to 8 hours maximum. After that, you should not be hanging. Suppose the patient is going for x-ray and then coming back again, and if you find that the hanging time is too long, then it is better to discard the fees and put the fresh one. Instead, it's getting wasted or it is there, you don't start immediately. See, whenever you are putting it a bag, put one sticker saying that the product the thing started at this much time. Okay, so it is 8 o'clock, the feeding started at 8 o'clock. So you know that more than 8 hours you should not be hanging it, and then you can throw it off. And date also you should mention whenever you're putting this bag. Date, time is very important for you to put it to the hang into the infusion pump. So so this is what I told. No, it
Yeah, I think
includes
you
the
already covered this. Yeah.
sterile formulas.
Yeah.
Yeah, hanging time.
Right. All this you
And you should complete this, when it is a closed system, we can keep it for 24 hours. Okay, not 48 hours, only if it is properly stored. Okay, many of the time we don't have a proper storage system inside ICU or anywhere, so it is better to discard before 24 hours. And whenever you, even this closed system, when you shift the patient for a theater, or you shift the patient for a x-ray or a CT, you must properly lock it, close it, and cover it with a sterile thing, and then only use it. So whenever you're doing it with proper gloves, you should be doing it, and proper method. Not that we need a sterile gloves, but definitely we need a gloves to see that you do all these with this thing. So it is always important, because the if you do it properly, the contamination is much reduced.
So, I mean, this recommendation we
Okay.
actually teach the nurses 24 to 48 hours. So, you
And
recommend
of
that?
course, nursing time. No, once contamination happens, diarrhea,
Yeah. So, you
48 hours we don't sit.
we don't. So I think we need to correct it. I think no, we will make that correction. So, 24 hours is the
Yeah,
maximum.
24 hours
Thank you. Thank you.
maximum. Yeah,
Yeah, I think this also you had already
yeah.
covered.
So
Yeah.
we have to touch this. Yeah, yeah. See, here I've written previous slide. So I've written here, hanging time closes less than 24 hours. Okay. So more than that, you don't hang.
Okay.
At the same time, open system, not more than 8 hours.
Okay, that's clear now. Yeah.
So, yeah, you have to be very clear in that, because there only problem lies. Okay. So then there are different methods of delivery. I said bolus, then I said continuous, intermittent, cyclic, and continuous. Bolus is where give large volume of formula, 250 ml, prepare it, and just put it in the syringe slowly to 30 minutes. Many of the time it doesn't happen. What they do, no, because you have to go to other patient, you just pour it just like that and go. So whenever you're doing that bolus feeding, not like that, 250 ml for 25 minutes, at least 20 minutes you should pour slowly, and then give. If at all you're giving bolus feeding, most of the times we go for continuous or cyclic or intermittent. Most of the hospitals follow this. Only in government sectors, in where home feeding is there. Okay, home feeding we use bolus. There we can't be using the feeding from system. Then we are, so whenever you're giving a bolus feed, see that you don't give, just pour it and give it. Okay, you don't dump the patient. It has to go slowly. Okay, at least you should take 20 minutes, minimum 20 minutes to put that 250 ml. Okay, so the intermediate is where we can give 4 hours, leave for 4 hours, and then do. This is used when you want to make the patient to mobilize. So that time this intermediate feeding is used. In cycling feeding, what happens is, whenever you want to give the in feeding pump, whenever you want to give, you give it for 12 hours and then stop it and do it. Most of them cyclic is not used. Intermediate and continuous, not that 24 hours, we can give for 16 hours and give a break. In Sundaram Medical Foundation, we use for 16 hours, and then we give a break for 4 hours for the night, and then we start from the early morning. So this is very useful, because it's more like our own feeding. No, you don't feed in the night and then you feel all that. So some of the times we give night feeds. Okay, so those time we don't give morning, we give oral, and only for the night we can give feeds also. 1 or 2 feeds will be giving in by enteral. Even that you should be knowing. But latest we are not following that, because we don't want to disturb patient during the sleeping time. So we try to put everything during the waking time whenever they are waked and they are, we don't disturb their sleep.
So I think it's the opposite of intermittent fasting. You're doing the intermittent feeding, right? For 14
Yes.
hours. And I think
Yeah, for and then yeah,
bolus is a little bit, impractical, if I may, make that observation.
it's not
Because I
practical.
don't think in this day and age anybody's got the patience to stand by the side of the patient and for 20
And
minutes.
give for 20 minutes,
Yeah.
doesn't happen. They push in the syringe. Many of the times I've seen on bedside to home enteral feeds and all. But better to go for continuous.
All right. Okay. So,
Always check the some of the complications which we can reduce is check the placement of ng tube. Okay, that is very very important, because this can be by oscillation you will know whether your place the tube, whether the tube is in the stomach. That is very very important. X-ray immediately when the patient tube is put, they have to be shifted to X-ray, confirm the X-ray, and then only start the feeding. Before confirmation from X-ray, from the X-ray, you should never start feeds. Okay, even if it is getting delayed to go to the X-ray to get this done, and still you can wait. Okay, so it's very important that check the position of the ng2 for by X-ray and then only start the feeds. Okay, you and then using pH strips also is one of the way where you know that the tube is placed in the stomach. So you can see this is the different methods where you can see, you can aspirate and see. Then you can see with the X-ray. I have seen in one of the patient, the X-ray was kept in the, the tube was kept in the lungs. Luckily, we could see that, and then we could report and say that it not in the government hospitals. One of the government hospital, when we went for rounds, we found that, and we immediately reported. And that's a very very sometimes it happens if you don't see the X-rays. So please see that it is done only after that. I think most of you are following the same principle. So this documentation is very important, because with this only we will be seeing the notes, doctor will be seeing the notes. So I've been telling her document, 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 because feeding route, feeding system, what additional water you've added, free water you've given. Sometimes after flushing the feeds, you'll push some water. Even that has to be measured and it has to be written. It's not just for cleaning the tube. Even that 50 ml where you flush the feeds has to be recorded in the document. So tolerance of the feeding, I told you these are the some methods which we have to see. All that has to be written. Nil residues, girth was normal, no stools or past stools in the morning, normal. All information has to go into the document every 24 hours.
okay, now we're coming to complications, and I think we're also running out a bit of time, so we need to go a little bit faster.
Quickly finish it. Yeah, right up. Yeah, sir. So this is, I told you, metabolic. It can be overhydration, dehydration, some of the electrolyte values. If you find any abnormalities, immediately inform. And also glucose abnormalities. If you find hyperglycemia, hypoglycemia, immediately report to the dietitian doctor, so that we can change it. Because you are at the bedside and you are the first person who will observe everything. So you please inform any abnormalities of glucose or electrolyte values. And second is gastrointestinal. I told you already, vomiting, diarrhea, pain in the abdomen. If the patient says, please don't just leave it, immediately report. Okay. Next slide. And it can be mechanical. This is a slide I told you, when a patient tube was placed in the lungs. So even the tube clogging, routine flush tube will avoid clogging. And using the scientific formula, there won't be any clogging. Okay. So using a scientific formula is very useful. Then using a blenderized formula, the milk, some people will say, I'll give soup, I'll give milk, I'll give this. Don't go for all that. Just go for commercial feed. The tube clogging will not happen, contamination won't happen, diarrhea won't be there. So better go for formula feeds. even though the cost is there, but the hospital stay will be reduced, the complications will be reduced. So better go for standard formula feeds. So you see these erosions, you can, this is because the tape what properly not placed, this simple nursing issue. Okay, so this could have been avoided.
And simple,
And also,
can we give
very important,
when you're giving tube feeding?
you should never give medicines along with tube feeding formula. Please take this message. The formulas are only for food. Okay, it is not for medicines. So if you want to give medicines, you have to give separately, not with the formula. Okay,
So can
you
we
can finish the
stop the formula and then flush it? How long should we wait?
yes, for 20 minutes, sir. After flushing 20 minutes, after that you can give, but not with the formula, because there'll be drug nutrient interaction. There'll be sometimes the medicine will clog the foods what we have been taking. Those things can happen. Sedimentations can happen.
I think that's a very clear message. Thank you so much. So the answer was no. And finally, I think we want to end with some best practices. We want you to give your expertise on what are the best practices on tube feeding.
So I would recommend that always you appropriate tube size is very important. So that will help a lot of confusions for a long run when you're giving. Pump is important. Tube placement, I told you, where it is. Check balloon for inflation if the patient is on post pyloric. And then you should be seeing that the feed tube is daily cleaned. Okay, neatly placed. Those things has to be done. Do not change dressing frequently, not necessary. Always see that you keep the patient bed on the elevated position. Most of them do it. That's why நம்ம கூட சொல்லுவோம் உட்கார்ந்து சாப்பிடுங்க வீட்ல கூட அப்படி we say. So same principle, even the patient is on bed, we should see that they are in this position where many of the complications will not happen. Aspiration will not happen if you put the patient on bed in 30 to 40 degrees Celsius. And document abnormalities. So this, if you do it, I think enteral feeding will be very easy for us and for the patient, where you can see the less complications and things like that. Thank you.
Yeah, I think there's something you wanted to cover on principles of food safety. Finally, we decided on this. So we
Yes,
go through it.
but then lack of time. Anyway, this I quickly say that you have to have proper containers whenever you're doing the hazard. You should be cleanly sterile containers if you're going to use it as a open system. If it's a covered system, then no problem. So if you're going to discard a unused formula, you have to throw it immediately. Don't keep it there and then you throw it later if you think the new nurse who is coming, the new, she may not know that is a contaminated formula. Sometimes she may take it and hang it also. So I mean, I'm saying just not that everybody does it, but it's an accident, it can happen. So discard unused formula immediately, and hanging formula, that precautions you take. You keep the workplace very neat, and all the equipment should be clean, and avoid colorants. Don't add colorants. No need of colorants, no need of medications. All this directly to the formula, don't add. This is all now it's not been recommended, and so you should not be doing all that. So these are very foods for to make the formula feeds more safe for the
Okay.
patient.
Food colorants, I mean, a lot of hospitals use food colorants, isn't it? I've seen pink color.
Yes, even in Sundaram Medical Foundation, we were using for a very long time. But then it has been stopped, and it is not recommended. Before we thought when for the aspiration, the for differentiating
Distinguishing.
the thing we were using, distinguishing the colors we were using it, but not recommended now, so it's not advised.
Okay. Right. This is the last slide.
So aseptic technique, label the enteral equipment. I told you, you should put the patient name, the formula, time when it started. All that is very important. Elevate is very, very important. Right patient, right formula, right tube is very formula. I told if you change the formulas, it is a problem. So you have to have the right formula and the right tube for insertion. And you always have you please say whenever the patient is taking a food, the transition, okay, from en to tn, or enteral to parenteral, or parenteral to enteral, or enteral to oral, all these, you can give us a lot of help for us to see where we can, in transition feeds, you are very, very useful to us. So you can see that whenever the patient is intake is fine, you can always report and see that. So these are very important aspects which you should be following, and I think this would really help for the good practice for enteral nutrition.